So welcome to 21 days challenge. Now you are on task 2, day number 2, task 2 of the mission 1. What was our mission 1? About the skeletal system. In mission number 1, for task 1, we have seen different planes. Now we are coming so before seeing this recording or doing this task, make sure that you have completed your task number 1. Don't directly jump to your task number 2. So what is your task number 2? As I said, our skeletal system is divided into axial skeletal and appendicular skeletal. Axial in the middle, whatever comes in the middle, spine, rib cage, girdle, and appendicular skeletal means our limbs, bones, whatever are there of upper limb, lower limb, they come under the appendicular skeletal. Now we will talk about axial skeletal. What comes main thing for upper side in axial skeletal? Yes, the most important bone is your scapular bone, which makes your scapular girdle. Now what is the scapular bone and where it is? It is called shoulder blade 2, which is behind us. Behind us. Here, when you place your hand, if you can't place like this, you just place your hand on the opposite scapula and you can feel. Now, as you are placing your hand on the opposite scapula, move your other hand and feel the movement. So that is your scapula, which we call shoulder blade, which is very much important when we do any appendicular activities like during our arm movements, even sometimes during this movement, stabilizing in one place. So today we will learn about more what all movements are possible for scapula. First is, there are, if I can say, that bone has 6 different movements. Yes, you heard it right. 6. First is when we do this shrugging. Yes, elevation and depression of scapula, that is shoulder blades. You can again keep your hand and feel it. Elevation and depression of that scapula. Second will be upward rotation, downward rotation. Upward rotation, when you move your hands up, the scapula, it shifts a little bit up. मतलब elevation तो हो रहा है, but that is not enough. It has to move like this also. Rotations, upward rotations. Okay, the blade of the blade spine of the scapula, which is the tip of the scapula behind, it moves outward when you do upward rotation. Same way when you come back, that is downward rotations. So 4 movements: elevation, depression, upward rotation and backward rotation. Keep your hand to feel it, all the movements. 5th and 6th movements are protraction. Protraction means you are abducting the scapula. Abduct means away. You are moving the scapula away from your spine. Behind, in the middle, you have spine. When you do protraction, the scapula moves away from the spine. And when you do retraction, back, the scapula moves towards the spine. So this is away, protraction, and in retraction towards the spine. So these all movements are required during our daily activities. When we are writing, when we say sit erect, we need to retract. When we have to reach, so isme elevation is also there and rotation is also there. When we just say, I don't know, that shrugging movement, that is also a scapular movement. Okay? Now what you have to do it in task number 2, you have to analyze your again daily activities, and for scapular movements, just write 1 activities which requires your scapula to move, and besides that just write direction, movement, whether it is elevation, depression, protraction, retraction, or upward and downward rotation, or sometimes combination also. So just write one ADL for scapular movement, and beside that you just write which movement of scapula you can observe. Come to the next point. During asana practice, write one asana of that which requires your scapular movement. Right now I will not tell you because you have to analyze it. You have to see, you have to feel it. That all during asana practice, how the scapular movement is affected, which all asanas are required to do scapular movements, that will be covered after you do the task in the live session. So finding out the ADL and finding out one ADL, one asana, that is your task 2, that is the half part. What is the second main bone in our axial skeleton? Yes. Are you guessing it? Right? Check it out. That one is, if I go back, pelvis. Your scapula makes your shoulder girdle, we say pectoral girdle also, but your pelvis, it makes your pelvic girdle. It is also called hip girdle too. So it is a combination of all. To show you the pelvis, so now this is your pelvis, front side, back side. Like how we analyze the scapular movements, we will do same thing. Here also, don't feel that your pelvis is rigid. Don't be surprised if I say your pelvis also moves in 6 different directions, like how your scapula moves. Only thing the difference is the range is available more in upper side than in lower side, but your pelvis also moves in 6 different directions. Now what are these directions? First we'll look at it here, and then we'll do it practically. Anterior and posterior tilt. 2 movements done, one is anterior, one is posterior. Third, lateral tilt. One side up, this is right side up, or this is left side up. Other side. So right side tilt up, or we can say left down and right down. So tilting of the pelvis in this direction. Okay. Now the second is rotations. Rotations to right, rotation to left. So this is 6 movements: anterior and posterior tilt 1 and 2, right up means tilting of pelvis this way, third tilting of pelvis left up, then rotations towards right, 5th one, and rotations towards 6th left, that is the 6th one. Okay? So same way we will do, check it out in our body. And as we know, same all these movements are required in our daily activities too. So for anterior pelvic, to feel your anterior and posterior pelvic tilt, one hand you can keep it just lower than your lower back, on your sacrum region you can say, one below your umbilicus you can say. Okay. Now just I'm moving it anterior and posterior, anterior and posterior. Just check it out how people move, and just see, this is anterior, this is posterior, anterior, posterior. Try it out this way also, don't worry. Now I am isolating, I am not doing trick movements, compensating with upper back. No, we don't have to do that. In task you have to do isolations. First do it with compensation, then try it out in isolation, and just note down the difference, because questions will be asked about your experience in the worksheet. So this is your anterior in isolation, this is your posterior, if you can see, anterior, posterior. This is more stable now, anterior, posterior. Do it both the way. Try with compensation and then without compensation. Same way this third and fourth movement is lifting the that I can show in standing, because we have a habit of standing on one leg. You can see when we stand like this, we are drooping one side and elevating one side. So this is tilts. If we stand on one side, so this is tilt of the pelvis, which we have habit, and we generally say we have to stand equally. So this is tilting of the pelvis when we do this way. Now what is the rotations when we move in sitting? If we move or in kneeling, up along with the upper back, our lower pelvic girdle also moves. I am not just doing from the upper back. Sometimes we need to restrict and do from upper back. But what if I have to reach something from up? This requires not only this upper body rotations but lower body rotations where pelvis is also moving in rotations. So what's your task for pelvis 2? One activity which requires your pelvic movement. Name the activity and name which movement. Anterior posterior tilt. Then what I said, rotations and tilting. So out of the 6 activities, choose 6 movements. You have to write it down. Whatever activity you have chosen, which movement is that. Second thing, you need to choose an asana also, where these pelvic movements are required. The what next thing? This is task number 2 we are talking about the scapular movements. You will get a worksheet and then you get a clear idea about the pelvic tilt. Now we need to do a task regard with to feel the movement more better way. For both the things, for both the movements, we need to do the task also. Now what task you have to do? This you are feeling it and feeling the worksheet, analyzing it. We need to, for scapular, we need to do 2 tasks. First is wall push-up. You need to stand with feet apart, more than 2 inches away from the wall so that your hands will be straight, and just write out push-ups and feel the movement of your scapula. Right now I am not giving any cues on yourself, whether, and try to do with feeling of the scapular movements, how it feels. Now the second task for scapular movement is wall slide. You have to stand against the wall and so that you can feel the movement. Just move your hand up and down from the side, and you can move from front also. But back of the wall, what you are doing, you are feeling the movement of scapula. So wall push-up and wall slides, you feel it, both the movements, and in the worksheet your questions will be guided according to your experience. So don't worry, that questions will also be guiding you about how you are doing it. Now this is a task number 2. Scapular movements, 1 activity, 1 ADL and 1 asana. Then for scapula, wall push-up and wall slide. Now what about pelvis? For pelvis, you have to analyze the movement, one movement, anterior and posterior tilt in, because it's very necessary. More than other movements of pelvis, you need to be aware of these 2 movements more, anterior and posterior tilt. So first you will feel it in standing. As I said, you will keep your hand on lower back, one on below the navel, and just feel the movement. Keep some proper wide base, and then you have to do with compensation and without compensation. Means upper body, you try it out and then do it properly. This is anterior tilt and this is posterior tilt. Anterior tilt, posterior tilt. Now same thing you will be doing while lying down. When we lie down, lie down with legs crossed. Back you will feel, you can keep your hands also on the back and then just feel the movement. Anterior tilt, posterior tilt. Anterior tilt, posterior tilt. So for pelvis also 2 positions you have to feel, and you will be getting guiding questions with both the movements what you did and how you felt it. That guiding questions will make you do once more and feel it, and then you can answer it. So that is the end of task number 2 regarding scapula and pelvis. If you can see the worksheet, you will be able to take it all together properly. Okay, thank you.